Thank you. Thank you. Nice. Main first. Okay.
Thank you. So the next phase would be to visit. When the DG was speaking, he mentioned that community that some people have cultural beliefs, so someone has to be buried almost immediately. So how does it work after you're done?
So whatever procedures that we are doing, yeah.
So basically you do the autopsy here, prepare the report, and then hand over to the family.
I'll just let it at that because we usually use it to move the bodies up to flush to the floor of the van so that you are able to move the specific body that you want to sample into the suit.
I'm Richard Omore. I work for Kemri. I'm a scientist here for about 32 years now. So we are here for one of the projects that is housed within the Family Health Unit, which I'm the lead scientist for Kemri. And this study is called CHAMS, and CHAMS means Child Health and Mortality Prevention Surveillance Study, as we'll talk about briefly after this. The Kemri has been piloting a research program to provide the facts of its kind, a mid-span, minimal invasive sampling procedure van. We'll call it MITS, as probably our colleagues will interact with you during the question session. So the goal of CHAMS is to actually track and profile preventable causes of death among children under 5, which actually would be more useful not only in Kenya but globally to understand what is the main causes of death among children under 5. And to do this, we need to ensure that we are able to pick samples and test them from children who die, because that's the cheapest way that we can actually know what causes death in these children. Combine that with clinical records and patient history, and have this information actually digested and debated upon by a panel of experts that I would actually briefly talk about. So the mid-span is one of the tools that we use to enroll children who die in this study and who we need to take samples from to be analyzed. So the minimal invasive sampling procedure van will be used for child mortality prevention surveillance, which, as I have said, aims to understand the track the preventable child deaths. This van was actually, plus its accessories, was bought at a cost of 70,000 USD by our fiduciary agent, HJF. So the mid-span concept was emanated from challenges that we encountered in enrolling, mixed cases or children who die into this study. because sometimes when we go to the community, we have communities where a child has to be buried quickly after death. We have communities where the health facility setting where the child dies do not have a morgue, so pathologists cannot actually perform minimal invasive procedure, that is taking blood samples using some needles. And therefore, we engaged with Gates Foundation, who are actually supporting this study. And Kenya was given the first chance to pilot this. This is the first of its kind, not only in Africa, but also in Asia or globally, to see how a minimal invasive procedure van can be used to engage with communities to have their children enroll in a study which has to take samples from a dead child within 24 hours. Because if the child has to be attended to, or if we have to take samples beyond 24 hours, the child would have decomposed, so we will not be able to actually get the actual pathogens or possible causes of death. So the project is being implemented by Kemri in collaboration with the Ministry of Health, County Health Management of Kisumu and Siaya, and through funds managed by Henry Jackson Foundation and support from CDC and Emory University. Also we have Liverpool University also currently involved in this. The things that we have observed preliminarily as being profiled as the main causes of death, based on data collected by this one and for the study, in kill malnutrition, contributing about 15% of deaths we see among the death cases for our site in Kenya. And also we have sepsis, contributing about 10%. We have malaria, around 10% as well. And I would actually circle back in malnutrition particularly, and again probably come to Klebsiella pneumoniae, which our DG talked about. In studies that we have conducted, part of my background is actually infectious disease epidemiology, and particularly vaccine preventable. And in our studies that we have done in Africa, actually, including Kenya and part of Asia, has shown that vaccine failure among children in African setting, compared with the US and developed countries, is linked to malnutrition. We have seen that children who are malnourished, they are less likely to benefit more from vaccines. And this study tends to show evidence that one of the reasons why vaccine failure is more rampant in Africa, probably, and Asia, is what we probably are seeing from this study. And also, one of the surprising preliminary results is Klebsiella pneumoniae as a pathogen, which is more prevalent in our setting. And Klebsiella pneumoniae is not just Kenya. When we look at data from other CHAM sites like South Africa, Mozambique, Mali, Sierra Leone, Ethiopia, Bangladesh, it is a crossover. And this is a pathogen that has previously been underestimated and has not been appreciated as a real cause of death. And that is important. As our DG mentioned, we provide data and we translate data into meaningful context for the Ministry of Health who lead data to action. For example, if there is now intervention to focus on reducing child mortality, it means this study is providing information that can guide our Ministry of Health in prioritizing action for better health. The information from this study is supposed to help the Ministry of Health design a way that can help prevent death at a larger level, not just at family level. And also it helps to reflect clinical management and improvement of therapeutic management in general. For example, we talked about Klebsiella pneumoniae. I said this pathogen previously has not been appreciated by scientists as a major cause of death. It's a pathogen that is associated with maybe if you are operated or you are recovering from a procedure, you can easily be exposed to it. But even in the community setting where there is no surgery, you find that this pathogen is causing death, meaning that the relative importance of this pathogen has not been appreciated by previous research and data. And those are kind of the new insights that this study brings into play and brings information into why we need to appraise this Klebsiella to another level. Already because of this, we have vaccine for Klebsiella being made, actually. I know vaccine for Klebsiella is already in the process. And that will really turn around the profile of this or the relative importance of this pathogen as a cause of death.
First of all, my name is Professor Elijah Maritim Songok. I'm the Acting Director General, CEO of Kemri. You know what we do in Kemri? The main thing in Kemri is to get new ways of disease prevention, disease diagnosis, and treatment. And we have been doing this for the last 40 years. And this is one of the testimonies of the things that we do, to be able to see what the gaps are there in our health systems. And then we decide on it, come with a new innovative way. Then we hand it over to the Ministry of Health, the county governments, to the region. Right now, use it for no usual practice. So today here, we are going to witness what Professor Mora has told you. One of our flagship projects is that when you are in communities, when children die, or even when adults die in our communities, the cause of death is usually not known. Or we always have to be able to transport the body all to the morgue, to the mortuaries. And it takes time. And those mortuaries may not be available at our community level. And it's very critical for us to know what has killed that person, so that we can be able to bring interventions to those ones who are living, and also bring other particular specific interventions. So this project, which we have been supported by Bill Gates, and which our team has really been working on, has been to actually have this van right at the village level. When there's a death, then immediately when the team is activated, we go and take the samples. Then from that, they can be able to inform not only the ministry, but you can also inform the community and even the household that this has been the cause of death of this particular child. We are seeing children more because majority of our deaths are mostly occurring of children. And you may note that sometimes when a child dies, especially in communities like this where there's a lot of malaria, people say here in malaria. But we realize that it's not malaria. There are other particular infections that are not malaria. And this is very critical in this. Like the studies that we have been doing right now, one of the things that we have known is that Klebsiella pneumonia is a very critical one in terms of the deaths of the kids, which has not been, most sometimes they say is malaria. So this is very critical as helping us or helping the country to know what the mortality is of the children. Then in that way, we'll be able to bring the interventions. As Siaya says, this one is around $70,000. And the support you have got from our partners has been great on this. And right now, we are going to have it, then we can continue with that particular activities that we have been doing, so I can be able to inform the country. And also right now, work with the county governments. Because us in Kemri, we get the data, we get the interventions, we say this is the best practice, then we hand it over to the ministries to be able to use for the usual practice. So what I can just say here is that we are very happy today that we are going to be able to have this one now handed over to us after we have done the pilots and we have said that this thing is really working. And the results that we have got from this is great. That now we could be able to have it. And then afterwards, as we are working on that, other countries are watching because the funder that has funded us for this, which is Bill Gates, want to replicate this in other countries. One of the countries they want to create is in Asia, in Bangladesh, they want to Latin America and other African countries. So it's very critical that the results that we have got from this is really great indeed, that's going to inform the whole world that how critical this particular facility is. So we are happy that you can be able to get this facility and show that with that particular investment, we could be able to have a result where you can be able to inform not only the family and community, but the ministry, and also the health fraternity, that this is the cause of death. And then we could be able to have particular interventions towards that. So in that, I would just say that this is a great concept that we are happy to be able to be part of with our various scientists. Kemri's main thing, Kemri is our strength is in our scientists, because when we have our scientists, these are the guys who could be able to pull in what you are seeing here. And see the facilities that we have here. You are seeing what you have reported during COVID time, times of vaccinations that we have, diagnosis that we have been supporting the country, has been because of our scientists. So this goes out another great appreciation for the very critical personnel that we have, that we really need the support, and we continue keeping those personnel so that they can be able to give us the good results that we have. So without that short remarks, I would just say that thank you very much for coming, and then afterwards we should be able to witness for us to be able to accept this one, and we'll show you the results that we have already got from the use of this one, and right now how it's going to be replicated is going to be moved forward. Asanteni sana. Thank you.